Hi, this is Shirley Gutkowski of Primal Air, orofacial myofunctional therapist and breathing retraining educator. And we are located, Primal Air is located in Sun Prairie, Wisconsin on Main Street. And I'm here to talk a little bit about what breathing can do and what we can do as myofunctional therapists for kids who have learning disabilities, who have problems in school, behavioral problems, all those kinds of things that you may not think about as a breathing problem or a facial structure problem. This is the biggest study to date on sleep-disordered breathing and its effects on behavior in children. We know that neurological building in children peaks between the ages of 2 and 8 years, and we call these the critical periods of brain development. So the earlier we catch on to these issues, the better. The peak period for tonsils and adenoids to grow big is about that same age range, and that for many children is the number one way that these kids have problems with breathing, is that these adenoids and these tonsils are in the way. We know that about 21% of children snore between the ages of 6 to 81 months, and symptoms peak at about 30 months of age, which is just over 2 years. And we know that there's almost a 100% increase in morbidity of neural behaviors, which is probably the absolute longest way to say behavior problems, that the brain development is occurring around the same time, and that's how things kind of continue to fall down. We don't have the right kind of oxygenation in order for the brain to develop to its genetic potential. Sleep-disordered breathing, SDB, and obstructive sleep apnea, OSA, and mouth breathing and just basic snoring all contribute to these behavior problems. Kids have peer problems, conduct in an aggressive manner. They are also prone to rule breaking, but more importantly is this impaired executive function. So impaired executive function example would be that a kid in second grade or even first grade is just screeching their chair along the floor in the classroom and bothering their neighbors, and the teacher has repeatedly asked that child to stop doing that behavior, and the kid won't stop and eventually gets sitting out in the hall for 10 minutes or 20 minutes, whatever, and then eventually gets sent to the principal, and eventually this child is on this pathway to never learning anything. But this kid never realized that his being tired, his screeching the chair on the floor in the classroom is what's interfering with his education. There's no if-then feature in the way that this child is thinking. That's what makes it so important to get this taken care of as soon as possible. ADHD and learning disabilities and special education are all intertwined. If a child is diagnosed with ADHD, he's 8 times more likely to also have a learning disability, 8 times more chance of having anxiety, and 3 times the incidence of low social competence. So how does that relate to breathing? Obstructive sleep apnea and sleep-disordered breathing are both terms that make you think that it happens only at night, but usually these kids don't breathe well during the day either. Here was a study comparing sleep apnea or sleep-disordered breathing with asthma to kind of look at both effects and how these kids react. And they looked at 263 kids with asthma and 266 controls and found that sleep-disordered breathing but not asthma is an independent predictor of behavioral problems. We know that myofunctional therapy has been successful in a number of these sleep kind of disorders. We have big researchers, especially recently, have been identifying muscle groups and asking patients to practice those muscle groups or practice activating those muscle groups in an attempt to reduce the sleep disordered breathing and make the person reduce their problems. And it's been very effective. A meta-analysis was even conducted a couple of years ago and found that people who have myofunctional therapy, adults who have myofunctional therapy, are able to reduce their sleep apnea scores by 50% and children by over 60%. It's big business. ADHD medication is huge. The numbers are unbelievable. 7% of the children in Wisconsin are taking ADHD medication. The economic impact in total has also been looked at in a number of different ways. This paper here is from 2007, and they looked at a number of different costs, including parental work loss and juvenile justice system costs of ADHD, and found that it was costing people over $40 billion a year. $40 billion in societal costs in childhood and adolescent ADHD. Not every child figures out how to harness their attention deficit disorders for good. We have many, many, many scientists and really great thinkers who really put their ADHD to work, and maybe they truly have ADHD, and the rest of the people who are struggling with that may really have a sleep disorder or a breathing disorder that could be addressed more appropriately. It's a worldwide phenomenon. This paper here is from 2015, and looking at the economic burden of ADHD in Scotland, and found that almost $15,000 a year was being spent on this problem. Here in Australia, same thing. There's almost $15,000 a year per person to pay for the expenses attributed to ADHD. But we have myofunctional therapy. Right now, Primal Air is the only myofunctional therapy practice in the area. We're here to help, and we know that we have some answers that could be really beneficial to everyone. Myofunctional therapy has also been found to be very helpful in reducing problems with wearing a CPAP machine. Some people really do well with their CPAP machines, but they maybe have trouble getting the mask to work right for them, and we can help with that. The exercises are very effective in reducing snoring and may be used as a public health practice. Pediatric sleep apnea is a disorder of facial growth. So the sooner that we get to these problems, the better. This paper here was written by Christian Guilleminault as one of the authors, who is one of the premier people in sleep research, sleep apnea research, and the person who gave us all of the scores that we're using in sleep apnea discussions. We do this at our practice in a number of different ways. Well, actually one way. We have our clients practice different techniques that stimulate different muscle groups that are affecting their breathing. My name is Shirley Gutkowski. I've been a dental hygienist since 1986, and I've always had a very strong pull for prevention. Dental hygienists are trained in prevention. We are the prevention specialist in the dental office, and the more that we look into these oral systemic links, we're the ones who are very often the one that can bring collaborative groups together to help solve problems. I follow Joy Moeller, who is a practitioner of myofunctional therapy for over 30 years. I think she just had her 40-year anniversary. She's still practicing in Los Angeles. Yeah, it's true. We use simple screening tools from paper tests to lip strength tests to neck circumference, blood pressure. We look inside the mouth as myofunctional therapists to see what structural is happening with the muscles. We use some other tools as well, and this is the depiction of the Malampati score of how much room there is in the back of the throat. We look at the tonsils to make sure that they're not taking up all the room. We look at posture to make sure that the head isn't being pushed forward in an attempt to open the airway. We take a records appointment, which can last up to 90 minutes. We take a lot of pictures, photographs, measurements, interviewing. And our simple treatments are easy for people to do. Everything from gargling to moving your tongue in a particular way for a particular amount of time. We spend 8 weeks breaking down the muscle memory that patients have accumulated over time so that they can learn new muscle pathways, new neuromuscular pathways from the muscles to the brain so that they can really get their airway to work better for them. We build healthful pathways into the reflex part of the brain in the habituation stage, where we ask patients to kind of keep track of how often they're practicing these techniques without really thinking about it. So that's what we do at Primal Air. I have a webpage, primalair.com. This is our phone number. We're happy to do any conversations with you on the phone or to come and speak to your group. We'd love to speak to parental groups. We'd love to speak with other kinds of groups, health groups, activity groups of all ages, of all styles, as we try to help everyone live healthier and save money. This is Shirley Gutkowski at Primal Air, signing off.